Okay, good. Now I'm live. So this is about me and my life and what I'm choosing to do. And I'm putting this out there now because YouTube has changed so much in the last, 5 years to where if you say you're doing something, people are acting like you're giving advice. I'm not giving advice because I don't know you. I'm just sharing what I'm doing, and it's a trial and error. I have a very specific sensitivity to foods. So this is just a story of what has worked for me and what hasn't, and the consequences and what has happened throughout the last 10 years of my life. Um, and you can go back in the videos and see that I was very obese. You could probably even go back to 2019 and see I'm a lot heavier now than I was in 2019. I'm 160 or 159. I was 127 in 2019. So if you like my videos, please let me know what you want me to talk about in my videos. Unfortunately, YouTube has gotten so big, my viewership has gone down quite significantly since, I don't know, 2015, 2014, 2013. So that's an issue there. And I'm not sure exactly how to get unless I put all my videos on Facebook or on LinkedIn. I can do that. And if you like my video, subscribe. But I want to know what people want to hear about. So, personal story that happened to me in 2012 before the ACA was enacted. Before Obama enacted the ACA, I had to wait until 2014 to get that, and it changed my life completely. It was amazing what it did. So 2012, it was February. I went to my general practitioner, and they told me I had an ovarian cyst, and it was 7 centimeters, and I had to have surgery. And actually, let me backtrack. That's not true. She said, you have an ovarian cyst at 7 centimeters, you probably have to have surgery. So that wasn't really a big thing. That was February. But because of the hospital I went to, they were overbooking people, and it was not a good hospital at the time. It was hard to talk to somebody to schedule an appointment with OBGYN because that's who I needed to see. Now, because the Affordable Care Act, I don't need to go through the rigmarole that I used to have to go to just to get an appointment. It was ridiculous to get an appointment with OBGYN before 2014, at least at this hospital that I went to. It was ridiculous. And it should never be that hard to get an OBGYN appointment. It should never be that hard at all. Doesn't matter what clinic you go to. It should be a direct line, and there should always be someone there answering the phone. Always. You don't mess around with women's health. So it took a while for me just to get an appointment with the OBGYN clinic. Now, mind you, it was February 2012 that I saw my general practitioner. So fast forward to August, I still hadn't seen an OBGYN, 2012. So 6 months later, I still hadn't seen anyone. And I was doubling over in pain. And I thought it was just period pain. And my mother said, Sandra, it's not normal for you to have this doubling over reaction of period pain. And I said, it's not. And I was in tears. And she's like, no, you have to go to the ER. Well, I think at the time my mother might have had to go to work. She retired from her job in 2013, and it was 2012. So she might have had to go into work. And I think I was like 30 something. Okay. I was like 36 or 37 or something like that. Because we're talking about almost 10 years ago. Next year will be 10 years. So I was like 37. So I drove to the ER myself in horrible pain. They gave me Dilaudid, which is good because uh, I have that gene mutation, and I can't even remember uh, what the gene mutation is called. CY6D something, something like that. I can't remember. I'm looking it up right now, but I can't find it. But I have a gene mutation that makes it bad to take codeine. I'm a poor metabolizer of that. Um, I'm a poor metabolizer of that class of drugs, codeine, Norco, all that stuff. It's just not good to take it because it not only could stay in my system longer, you don't want to drive when you have codeine, stuff like that, or hydrocodone, but it's like eating air for me because I'm a poor metabolizer of that gene mutation, whichever it is, CYPD26D or something like that. So because of that, I just found out that out from my doctor like 6 months ago. Because of that, I was like, oh, that's why I take codeine, Tylenol codeine, and it doesn't work. It's like eating air. So I've been taking ibuprofen. Well, there's an issue with me taking ibuprofen. So I'm going to share that with you later because I've been taking a lot of ibuprofen lately, a lot. And I'm talking about, when I say a lot, I mean more than once a month. Okay. I usually take ibuprofen only when I'm on my period and only one day of my period. One day. That's it. Because I don't like taking ibuprofen. I don't like it at all. So back up to this 2012, when I was doubling over in pain, they gave me Dilaudid. Thank God they gave me Dilaudid. And that sped up the process because the clinic or the emergency room that I was in had the clinic there. It was Riverside University Health Systems. And at the time, I think it was called something else. It might have been called Riverside County Regional Medical Center at the time. And they said, we're going to get an OBGYN over here. They're going to talk to you, blah, 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 blah. And it was in the documents. And then they said, we're going to have somebody call you to get an appointment because you can't wait. This is really bad. It was really bad pain. It was really bad pain. On a scale of 1 to 10, I would say it was like a 15. It was that bad. And because of that ER visit, August, September, I think it was by September, I was on the phone with someone making an appointment for a pre-op appointment in October. And then my surgery happened in October. And I want to say it was about 2 weeks after my visit to the ER that I had an OBGYN appointment with a doctor. And that's when I was left in the room alone. I went into the room alone and the doctor came in and said, oh, you have an ovarian cyst, is 7 centimeters. Okay, we just need to do surgery. Okay, somebody will be in a few minutes to explain everything to you. Okay, bye. I was left in the room alone. My mom was not in there with me. And I don't know, I can't tell you because it happened so long ago. She might have been at work. I don't know. She might have been in the waiting room. I don't know. I know that when the doctor came in, he just left me in that room that was basically 8 feet by 10 feet. And after 15 minutes, I was bawling. I was only 37 years old. So being told I had an ovarian cyst, and he said, I'll have someone come in and explain everything to you in a few minutes. Well, a few minutes to doctors could mean a half an hour. You don't leave a patient in a room alone for a half an hour. You don't leave a patient in a room 15 minutes. You don't do that. So after 15 minutes, I went out into the hallway bawling, and nobody really paid attention to me. They were kind of ignoring me until I really made a scene with me crying to get some attention. I needed answers. I was scared. And they said, who left you in there? And I was like, oh, no, some doctor that works here. I don't know. And they were like, what's your name? And then I told them, they were like, oh, my God, they left Sandra in there alone, because they looked up why I was there. I needed surgery. I was there for a consult. And they were like, oh, my God, he left you in there. And I go, yeah, I was in there alone for 15 minutes. And here I am bawling. So they come back and they explain to me everything. And they didn't explain to me everything fully. I needed a CA125 test, which tests your cancer, blah, 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 your risk. They didn't explain that to me in thorough detail, so I was scared about that. But there is one thing that I did between February 2012 and this appointment, which this appointment with the OBGYN was either August or September 2012. Okay, so a very long February, March, April, May, June, July, August, September. So 6 or 7 months. I was doing something to shrink my ovarian cyst. So I went online looking for alternative therapies. What can I do to shrink this ovarian cyst? And I really wasn't doing the keto diet back then. I wasn't doing gluten-free like I am now. I wasn't eating a lot of cruciferous vegetables. So I can't attribute anything that I was doing to shrink the ovarian cyst, because I did shrink it. It was 7 centimeters. And if it's over 5, my doctor told me if it's over 5, it needs to come out. You don't want an ovarian cyst that's 5 centimeters or more. So I immediately went to the internet and looked up alternative therapies, and I found that apple cider vinegar can shrink ovarian cysts. So I was drinking probably about 50, 60 ounces of water a day. And in the beginning, I was taking 8 ounces of water and putting a teaspoon of apple cider vinegar with the mother in 8 ounces of water. And it took about a week to get used to that because I wasn't really used to it. And then after that week, I said, okay, now I can do 16 ounces of water, 1 tablespoon. Well, my body started to crave the apple cider vinegar. I started to enjoy it. So after about 4 weeks, I said, now I can do 16 ounces of water with 2 tablespoons of apple cider vinegar in it. Okay. After about 3 months of 16 ounces of water in the morning, first thing in the morning, 16 ounces of water, poop, 2 tablespoons of apple cider vinegar. After 3 months, I was doing that twice a day, in addition to all the other water I was drinking. I was craving apple cider vinegar. So like I said, I wasn't doing keto. I wasn't doing gluten-free. I'm not doing keto now. I'm probably going to do a moderation of keto, 60, 70 grams of fat a day. I'm probably going to do that because I have a lot of inflammation. It's all over my body. So it wasn't really anything that I was doing other than the apple cider vinegar, and I was drinking a lot of tea. Bigelow used to have a tea. I don't think they make it anymore unless I get it online, but Bigelow used to have a fabulous tea. I wish they would make it now, but I don't think they do. And it was called green chai tea. And it was so good. Now, back in those days, I used to use honey. I don't do honey anymore. Now I use organic maple syrup. I find that for me, it's better for me. So no more honey. And back in those days, I was drinking 4 to 5 mugs of Bigelow tea, the green chai tea. It had the perfect blend of green tea mixed in with the chai tea, and it was perfect. I did other teas as well here and there, but normally it was 4 to 5 cups of tea a day. Was it the tea that shrunk my cyst? I don't know. I think it was the apple cider vinegar. because there's nothing else that I was doing. It's not like I was eating 6 or 5 or 4 servings of cruciferous vegetables a day. I wasn't doing that. I wasn't really dairy free like I am now. I was soy free. I wasn't doing the soy milk because I knew that would contribute to the estrogen, and the estrogen would contribute to the growth. It could contribute to the growth of my ovarian cyst. I didn't want to drink anything soy. I didn't want anything soy at all, but I still was eating cheese. Even though I wasn't doing dairy milk, I still was eating cheese. So the only really thing that I can attribute it to is the apple cider vinegar. So what happened was, after I talked to my doctor, and it was the OBGYN doctor, whoever that was, it sped up the process, and they said, we're going to have somebody contact you for the surgery. And, I had to jump through hoops just to get this appointment. I had to call just to get this appointment with the OBGYN. And again, this was 2012. So about 2-3 weeks later, they said, we're calling for your pre-op. Great. My surgery for my ovarian cyst was October 2012. And I want to say it was October 12th, but could have been the 13th of 2012. And immediately when I woke up, I asked the doctor, do I have cancer? He said, no, you don't. And I said, tell me about the cyst. And he said, well, it was really tiny. He said, it was 7 centimeters when you were told about it in February, but when I found it, it was very tiny, microscopic. And I said, like 1 millimeter? He's like, yeah, maybe even smaller. But he said, what did you do to make it so tiny? And here I am talking like this because I just woke up from surgery. I was talking like that, right? And I had surgery when I was a teenager from the hip accident that I had when I was 13 in 1988. So I knew what to expect going into surgery. And this was laparoscopic. So I was telling him, I had apple cider vinegar. I drank apple cider vinegar. I was talking like that because my voice, that's what happens when you have surgery. You're dry. So I was asking him a bunch of questions like, do I have cancer? What did you see? And I said, okay, what about my ovary? He said, we had to take your ovary. The ovary was intertwined with the cyst. Even though my cyst was shrunk down, it was still entwined, tangled. It was tangled. And I said, so that's probably why I was in so much pain. He said, probably. He said, you were experiencing a lot of pain, probably because the fallopian tube and the ovary was all in the cyst, and it was just kind of like muddled up and tangled and everything. And could have been like a rope, like putting pressure on the ovary. And that's probably what I was feeling. And I had no endometriosis at the time. In 2012, I did not have endometriosis. I did have scar tissue inside my belly, which was weird because he said it was near my spleen, which he said an infection in the gut would have done that. I didn't have any abdominal surgeries at all before 2012. So I don't know how that happened. He cut that away, which suggests there's more scar tissue now because it grows back. So he sewed me up and everything was fine. And I stopped the apple cider vinegar along the way. Somewhere around 2014, 2015, I stopped drinking apple cider vinegar. And now I need to go back on it. But there's something there, and I can't tell you definitively, yes, it was the apple cider vinegar that shrunk my cyst, but I think it was. Now, I have type 2, apparently I have type 2 inflammation, and it is associated with, you can look it up yourself, type 2 inflammation is associated with asthma, which I do not have. It's associated with dermatitis, which I do have, and it's associated with polyps. And I do have polyps. I forgot that I had polyps from when I went to an ENT back in 2012, and I just went again because my neurologist said, I want you to go to ENT to find out if you have polyps or a deviated symptom, because I went to the neurologist to get a test to see if I have dementia, because the word recall issue was having a problem. Word recall, I'd look at it like, what is that? Oh, it's a Christmas stocking. I knew what it was, but I couldn't say the word. Like, oh, what is that? Oh, it's a step stool, right? Just word recall. So I played word games like 6 months ago. I'd write the words down and say them. I would look at the word and say it. And then I would look at the trash can. Trash can was never an issue. But step stool was, or Christmas stocking, or trying to think of another word that was on the list that was kind of hard to remember. Coffee pot wasn't a hard word, but step stool, I remember, was a difficult word. I was like, what is that thing called? I know what it is. I just don't know the word. So the neurologist said, no, I don't think you have dementia. You're just stress. And I'm going to check your nose out and check your head out and see if you had a stroke. So we did the whole head scan thing and everything. But I got the results from the head scan, and it said nasal polyps. And I'm like, oh, great. So that type 2 inflammation is associated with asthma and nasal polyps and dermatitis. And I have 2 out of the 3. I do have skin flare-ups. And I do have sensitivities, skin sensitivities, food sensitivities. The allergist that I just saw said it's not an allergy. And I said, then what is it? He said, maybe you have an intolerance or an insensitivity to certain things. Eggs, I do have a allergy to eggs. It's very slight, but it's the egg white. Good thing I like egg yolk. I like the yolk. I don't like the whites. But that's why I'm doing gluten-free, because I get puffy if I have gluten. It just puffs up. Dairy does the same thing. I'll get acne. So, I don't know. I don't want to change my diet. I don't want to go off of gluten. I don't want to go off and start eating gluten. I don't want to start eating dairy. It's just not something that I really want to do. And believe me, I had a coach in 2018. I lost 80 pounds. It took me a year and a half to do that. But 2020 was a whopper of a year. And boy, did this girl whopper. I went way up. I went from 127 in August to 2019 to 160 by August 2020. Then I went back down to 145, and now I'm 159 again. So, I'm an overeater. Now I understand alcoholism. Little segue. Now I understand alcoholism and alcoholics. I cannot buy Simple Mills brands, gluten-free crackers. I can't. I will eat the whole entire box in 3 or 4 hours. I can't do it. There is no moderation within my mind when I buy Simple Mills gluten-free crackers. I want to say chips, but it doesn't matter. They're gluten-free and they're crunchy and I love them, and I go after them like crazy and I can't control myself. So I can't buy them. And it's the same thing with cassava flour chips from the Siete brand. I can't buy them. I'm overeating, and this is what you get. I am obese because I'm only 5'2". And I forgot. I'm going to segue and look over here because I got the live chat going. Glad to hear you got those things shrunk. Well, that's the ovarian cyst. I'm going to try to shrink these nasal polyps. I'm going to try to shrink them. This is not medical advice. This is just something that I'm trying to do on my own. I had nasal polyps too. I had them removed 2 decades ago, but they pop back up. See, they do that. That's what I've been researching. I'm like, why would I want to get the surgery if they come back? Okay, I had my hip dislocated when I was 13, so I had 2 screws put in 1988. Imagine dislocating your hip, just walking along, going to the ice cream truck and slip and fall, and you get it back up, and you're like, down and you get back up, you put weight on your leg, you start walking and you fall. 3 times I fell and 3 times I got back up and I was like, I can't walk. My best friend had to go get my stepfather. So I was 13 and I had surgery and I was scared to death, but I was also in great pain. Oh my God. So when I was 14, I had the screws removed. Of course, I went under. And then that was 2. And then I had my ovarian cyst removed. That was 3 in October of 2012. Thank God I had that done. Took forever. It wasn't a lot of pain. And then I had a 4th surgery of December 2016. I had a appendicitis. My mother did not come to me with that because she had dementia and she wasn't driving and it was really bad. So I went in alone and a friend of mine had to take me home, and I went in at 4 a.m. in the morning and I was going home at 7 at night. I did not stay overnight. And that's when I found out I had endometriosis, was December 2016. And then I had a total hip replacement in 2013. So 1 year after this removal of my ovarian cyst, I had a total hip replacement. It's been, I want to say 8 years, 2013, 9 years, 8 years, 8 years. It's been since my total hip replacement. Do you think I want another surgery? No. And if they come back, no. I was like, why would I want a surgery? And plus the anxiety of me not being able to breathe. I could feel it. I could feel this kind of full. It's like a full feeling. And I felt this when I was 207 pounds back in 2012 or 2000, whatever year it was, when I went back to the ENT back, I think it was 2012 or 2013. I was about 207 pounds, 202, because I remember having my hip replacement. I was about 202 pounds. I remember this little trick that works. Just pushing on my nose. It opens it up. It does something magical. And that's why I like the nasal strips and wearing them during the day. And it's funny because I spent so much time last year on the anger. I was so angry last year that I couldn't really see deeper than the mask. Like, you gotta wear a mask, you gotta wear a mask. Now everybody thinks gonna think I'm a Trump supporter, right? So I could have worn a mask with a nasal strip over, opening up my breathing instead of going into the anger of everything. And I got a medical note from a therapist that says I could wear a plastic shield and everything like that. But I didn't really realize how blocked up this felt. I thought it was just my imagination. Like, why is it that just doing that feels so much better? It's the freaking polyps, I bet you. It's the polyps doing that stuff. So now I'm like, all right, maybe the apple cider vinegar will shrink them down because of this type 2 inflammation. And I'm like, crap, I got to do an anti-inflammatory diet. Crap. So kind of, I hate to say it, but I really, really like the whole food plant-based diet. It just seems to work better, but there are parts of keto that I like too. I don't like a lot of keto because of all the meat. Meat makes my gut feel heavy. I don't like keto because of all the dairy. Dairy breaks out my skin. I don't like it. It will cause an inflammation response. But I do like keto in certain aspects of it. But usually it'll say 100, 120, 110 grams of fat. That is way too much grams of fat to me. I mean, that's just outrageous. A lot. 60, 50, 70 grams of fat will work well for me. And I did a little bit, but I noted, because I already did this back in 2019 or 2018 in the fall. And once I started adding in more fat and decreased all the vegetables and added in more fat, my weight lost all. I was like, no. And I just recently did a whole food plant-based. I tried to do a month. It was 3 weeks, no oil and no fish. I was already doing no dairy. I was already doing no gluten. And I was like, no oil, no fish. Okay, I'll cut out the, I was doing a little bit of pork, just a little bit here and there. And I did go off, like I went unclean. I'm going to say unclean because I was eating more bacon, especially in 2020. I was like, oh, fine, I'll eat bacon. I don't know when we're going to get out of this COVID thing. And what I mean by that is government lockdown. So I was like, fine, eat bacon because it's fat. It wasn't carbs because there's so much I know I can't have. I'm like, well, what can I have? Right. And guys, I didn't eat pork for 10 years. From 2001 to 2011, I didn't eat pork. I think I started eating pork again in 2012 because I went to a Bible college, a cult, and I worked in the kitchen, and I walked in and they had pigs, dead pigs. And once I saw the dead pigs, I was like, nope, no more. I'm not eating pork. Nope. Mm-mm. It was Mardi Gras, and they served pork and pork burgers. And I was like, I know what this is. This is the pork from in there. It's the dead pigs. And I got sick. And I was like, I'm not eating that. That was it. I was like, nope. So I don't have a problem with not eating pork. I can go back to who I was back then. If I did it for 10 years before, I can do it for another 20, 30, 40 years again. It's not going to hurt me not to eat pork. I mean, any at all. So now I'm like breaking down. Like when I say breaking down, I mean putting the law on, putting my foot down. You are going to parent yourself. There is no mommy. My mommy is in heaven. I mean, this is it. I need to do this for me. I need to go back on the apple cider vinegar and see if it'll shrink these little things up here, because I've tried the little nasal strips, and sometimes they stick, but I get up at 5 a.m. in the morning. I don't go to bed until 9 or 10 o'clock at night. The nasal strips don't stay on the nose that long. And you're walking around, you're touching your face, you're doing this, it's gonna come off. And I'm just like, okay, there's gotta be other ways. I don't want a steroid spray. I don't want to do that. I'm not one that likes pharmaceuticals. I don't do a lot of pharmaceuticals. I just don't like them. So I started looking up other things that I can do, and I heard from Dr. Berg, which I discovered in 2018. I just watched a video, and it said kimchi. Eat some kimchi. There's a fungal, or is it antibacterial, antifungal, whatever's in the kimchi. It seems to help this lining in the sinus, the polyps. And I thought, all right, I have kimchi in the fridge. I'll do that. I'm kind of what's it called? I'm kind of partial to kimchi because when I was in Bible college in Indiana, I used to go on a bus route to Chicago. It's called bus calling. It's just knocking on doors to find adults that allow their children to go to church on the bus, and they sign a release. That's all it is. Do you want to have your kids go to church? Let's sign them up to go to church. We'll bus them in. That's it. And this one woman that lived in Chicago had children. I'm sure she's still alive. She has to be my age, or maybe in her 50s. But she made the best kimchi, and she was Korean. Oh my God, she made the best kimchi. And the kimchi in the store is just not the same. So I'm partial to it. And I bought some kimchi, and I was like, fine. And I tried it earlier today. It was pretty good. But Dr. Bird said the sauce, the kimchi sauce, dilute it with water, put it in a Q-tip, and shove it up your nose. And I was like, all right, I'll try that. But there was other things too. There's tea tree oil. So this is tea tree oil with coconut oil. And I use this, believe it or not, on my skin. I've been using this on my skin for a good 6 months. whenever I have a flare up, especially this patch that likes to grow back here, might go to my doctor if it continues to see if it's skin cancer because it's not going away. And my mom had squamous cell skin cancer. She had a patch similar to this on her leg. She actually had two. She had two. One in 2015 and another one in 2016. And this 2016 one, she had to have Mohs surgery. Look that up. Mohs surgery. MOHS. Not something you want to go through when they just shave the skin. Not shaving your hair, the skin. They shave the skin. Yeah, I've been using this just to, and then anytime I get like a little tiny thing of acne, I will use the tea tree oil mixed in with the coconut oil for my face, just to give a little bit of moisturizer and the whole antibacterial, antimicrobial, antifungal effect. And of course, thank you, COVID, because I wash my hands like crazy now. I wash them. And I recently took that serve safe food handler certificate, and then I had to do another one for Riverside County. So that reiterated, because I'm looking for a job. I need to be essential. I need to be an essential worker. So that reiterated all the pathogens in our food. And I was like, oh God, that's disgusting. Let me wash my hands more. So it just helps me with my skincare. I take my skincare, and you could see I'm itching my face because it itches. But it's a very important thing for me to take care of my skin because of the issues that I have with food that affects my skin. I am extremely sensitive. So I don't know if me taking the kimchi sauce and then pouring water in the sauce and then me getting a Q-tip and going around and around and shoving the kimchi sauce diluted with water is going to shrink these little polyps. I don't know if me drinking 16 ounces of water a day with 2 tablespoons of apple cider vinegar, doing that twice a day, so I would be drinking 36 ounces of water with 4 tablespoons of apple cider vinegar. I don't know if that is going to shrink my polyps, but nasal polyps is an inflammation response, just like asthma and dermatitis. It is a type 2 inflammation problem. And apparently I have it. I've never been told I have asthma, but maybe I do. I don't know. I've never been told I have asthma. But I can tell you, it's not fun having any sinus infections. I used to have chronic sinus infections, chronic. I would have them 4, 5, 6 times a year before 2018. And I want to say I attribute to me not having as many because I lost the 80 pounds. I went from 207 to 127. Now I'm 160. Now I find that I'm best at 136, 138, 140. Once I hit 150, 160, that's it. I'm in total pain. It's not good. I feel it in my knees. I feel it in my hips. This arm was hurting. This right arm of mine was just hurting the other day. And I was like, you need to go back to intermittent fasting. It works for me. I'm not saying it's going to work for everybody, but it works for me. And I need to go back to what's working for me. And it's tough. I was so tough on myself in 2018. I didn't do, what's it called? Splenda. I didn't do stevia. I didn't do monk fruit. I didn't do any of those. All I put in my coffee was coconut oil, not a lot of butter because butter has salt in it. You can get the salt-free butter, but I did more coconut oil. But I'm learning more about me. I don't really like the taste of coconut oil. I really don't. But I don't like salted butter in my coffee because of the salt. And if you don't know what that is, it's a keto thing. That is a keto thing because you don't want sugar. That's like or equal in your coffee. That's like, so I still don't do sugar in my coffee, but I started adding in that not equal, but other stuff, the monk fruit and the other stuff. But it still, for me, it still stimulates my sweet receptors. It turns them on to where I'm craving something sweet. And I'm just like, no, unfortunately, I don't want to say I'm going to go keto because then I'm going to be counting my macros. And I don't want to do that. I'm not whole, like one of those people, oh, you do keto. And they're like, oh, keto, 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 keto. And then they like, what do you call it? They crucify anything vegan, or if you're vegan or whole food plant-based, and then they crucify anything keto, or if you're paleo, or if you're a vegan and you crucify anything paleo. Paleo is caveman, I believe, and the paleo is no grains, which I agree with. Low grains, no grains. I don't eat a lot of corn chips once in a while, but corn, just corn, I don't do it because it's GMO. I just don't eat a lot of corn. A lot of people do it because it's a filler food. They just do it, and it doesn't digest. You poop it right out into the, it doesn't digest at all. So why should I eat it if I can't digest it? That for anybody else, okay, but for me, no. So this journey is all started way back in 2018, and I know what I need to do. I don't need a life coach now. I mean, I don't need, everyday, help. I mean, a lot of stuff I can get just by researching. I got books, tons and tons of books that I could read on inflammation and anti-inflammatory diets, which the standard American diet is a high inflammation diet. And I can thank my own mind for me eating some things that contribute to inflammation because it is on my gut. It's all here. You can go back in my videos and watch me and see me when I was butterball face and everything like that. And it was like, and just because it's my weight gain is not here, don't mean it ain't there. It's all over. Believe me, it's on my hips. It's on my back. It's on my belly. It's on my arm. I could feel it. I gained more arm fat since 2019. Yeah, 2019. Christmas 2019 is when I started saying, okay, just a little bit of gluten, just a little bit of barbecue sauce, just a little bit of this. And it's like, once I say just a little bit, the floodgates open. And that's why it's so hard to go to other people's places to eat anything, because gluten is in the barbecue sauce, unless you buy the specific barbecue sauce that I have. And what am I going to do? Am I going to bring my own barbecue sauce to places and say, here, make the chicken with this barbecue sauce like a day before? I'm not going to do that. I'm not going to tell people or ask them, can you make chicken with this barbecue sauce? I'm not going to do that. That to me just sounds overdoing it. But I will guarantee you, if I have something with gluten in it, my face will puff up, and then it'll take about 5, 6, 7 days for it to go back down again. Every time gluten, I have dairy-free ice cream. Every time there's gluten in it. So most people would say you have a very bland diet. And sometimes I would agree. Yes, sometimes I would agree. Unless I make a soup that's homemade and it has chives and oregano and fennel and or onion powder and onion and garlic powder and all these wonderful spices that make food really tasty, really tasty. So there are other things that I can do to lower the inflammation in these polyps, but surgery is out of the question because the nasal polyps come back. And with the anxiety, I really don't want to be the one in there saying, I can't breathe when I wake up from surgery, because I've been told, because I already asked the ENT 10 years ago. He said, if you have the surgery, you will probably find that it's very difficult to breathe the first 3 or 4 days after the surgery. And I said, no, thank you. No. And my mom said, I can't breathe pretty much every day for 2 years before she died. It had nothing to do with her sinus, or it had to do with her dementia and probably not knowing how to communicate properly. She said things that she didn't mean, and she couldn't tell me that she was hungry. She just couldn't tell me that she was starving. And I was like, why is she not eating? She didn't know to eat. She had dementia. Sad thing is, she wasn't diagnosed until 3 weeks before her death, or 2 weeks before her death. So I don't really want to be reminded of my mother coming out of surgery saying, I can't breathe, it hurts. And I can imagine if you have nasal polyp surgery, you probably have something packed in your nose. I would think that you have some kind of tissue in your nose. Excuse me, why would I want tissue in my nose? I would pull it right out to be able to breathe. I'm not going to be a mouth breather. No, mouth breathing is not, it's not a healthy thing to do. Look up the parasympathetic nervous system. Nose breathing is very healthy. It's very healthy. And it helps people with anxiety like me. And I thought it was all in my head. I thought, this whole time, like pressing on my nose was just a figment of my imagination. I'm like, no, that really works. It really does. So we'll see what happens with the whole different things that I'm going to try to shrink these things down, because I don't want to take a steroid spray. I don't. It's going to go up into my eyes. I have astigmatism. It could go up into my brain. It could change hormones in my body. I'm already going through perimenopause. I don't want to mess with my hormones. I don't want to have a spray go up into my eyes and affect that. No. I've already committed to taking one drug every day for the rest of my life, and that is Armour Thyroid. And that's the only thing I take every day. Oh, and the ibuprofen. It affects gut health. The ibuprofen affects the gut, the lining of the gut, and the microbiome. So because I'm trying to heal and clean up my microbiome, I don't want to keep on taking ibuprofen. And I recently started taking a lot of ibuprofen because my doctor told me 6 months ago, you have this CYAP2D6 something gene mutation, and it just makes it difficult to metabolize codeine and hydrocodone. So I said, what do you suggest? And he goes, ibuprofen. And I go, and if I need something stronger, he goes, morphine. I'm like, oh, the big guns, okay. So, and I'm thinking there's other classifications of drugs that have nothing to do with pain receptors, but I'm thinking there's other drugs such as Effexor and drugs like that. There could be a whole list. I'm sure there are that work on that one gene, which affect me, which would make it ineffective to take the drug, or it would be basically a poor metabolizer. Just means your body doesn't get rid of the drug quickly. The more of the drug stays in your system longer. So and I thought it was all in my head. Like, why is it when I'm taking Tylenol with codeine, nothing works? Or I take a hydrocodone and they were like, how your pain? And I'm like, nothing. And they were like, nothing. And I'm like, yeah, didn't do anything for my pain. It's like eating air. That's really good. Seriously. I could take a hydrocodone and it does absolutely nothing for my pain. Nothing at all. Absolutely nothing. Like drinking water. I would say drinking water is better because our bodies are 70% water. And water would probably, it could increase the blood flow to all this and everything. And I would think if I increase my blood flow to my sinuses, maybe it'll open stuff up and make me feel like I can breathe better. I was doing something right in 2018 because I had so much energy. I thought my sleep apnea went away. I put away my BiPAP machine. I was using it 2014, 2015, 2016, 2017. Fall 2018 came and I said, dang, I got so much energy. This is great. It was my diet. It was my diet because I was saying no to so much. And believe me, people, the standard American diet, people just don't understand. They go, you don't eat bread and you don't have milk, cow's milk. And they go, well, if you don't eat bread and you don't have milk, then what do you eat? And I literally say, you ever heard of nuts? You ever heard of seeds? And they go, nuts? And I go, yeah, like macadamia nuts, pistachio nuts, almonds, walnuts. And they go, oh, those type of nuts. I'm like, yeah, what other kind of nuts do you know about? I don't know. I'm like, yeah, I don't eat peanuts. I don't eat peanuts. To me, they're not a healthy nut, and they're a legume as well. So I don't eat peanuts. But yeah, and I would say, they would say, that's all you eat is nuts. And I go, geez, no. And they go, well, if you don't eat bread and you don't eat milk, cow's milk. And I go, well, you ever heard of coconut milk? And they go, oh, coconut milk. And they go, but that's it? And I go, vegetables? And they go, oh, yeah, vegetables. And I literally been told this. I literally have heard this from multiple people. Oh, I don't eat vegetables. And I'm like, and I'm not keto anymore. I used to be like, can I have potatoes? I'll have a potato before I eat gluten-free bread. I love gluten-free bread, but there's no nutritional value in it. I'll have a potato first. So I'm thinking it's probably going to take me 6 months to a year to see any effect. If I am dedicated to doing what I need to do to decrease the inflammation in my body, because I don't get sinus infections like I used to. I just don't. Once a year, maybe twice a year. Last year was different because I had this tooth that was giving me issues, and they were saying in December 2019, they were saying, I think it's a root canal. You have to go to this place. And every time my dentist sends me there, that's always the same place, and they don't take Medi-Cal. And I'm like, fine. You have to pay $93. Isn't there a place that can get a test to see if it's a root canal for free and cover it under my insurance? Please, there's got to be a place. But because COVID hit, it slowed everything down and it backed everything up, and everything just came to a halt. Everything came to a halt. Nobody was talking about dentists. Everybody was COVID, mask, COVID, mask. Nobody was talking about dentists or endodontists. It was like crazy last year. And this thing continued to hurt finally. And I think it was in August. They said, oh, yeah, it's a cracked tooth. Prove it. Can't. It's a cracked tooth, because every time I opened, it hurt. Closed, it was fine. Open, it hurt. It's a sign it's a cracked tooth. 2 places said it's a cracked tooth. My dentist said, here's the bill if you want to do it, $5,000 for the pulling and then the bone graft and all that. And I was like, I'm not getting what do you call that? An implant. I'm like, I'm 45 years old. You think I'm going to pay for a bone graft and an implant? I was like, you're nuts. You are absolutely insane to think I'm going to pay for an implant for one tooth at 45 years of now. If I was 65 or 85, maybe. But at 45, no, I'm too young. So I called another dentist, and they said, we can save your tooth. We can do the root canal. And I said, don't blow sunshine up my butt. Don't do it. He's like, I'm not. I can save your tooth. And I paid $1,500 instead of going to Mexico, because I had an appointment to go to Mexico, to Tijuana last year in March, and COVID hit. And I was like, I'm not going down there. I'm not going down there. No way. I'll wait. I was going to wait until like May or June to go down to Mexico, but we all know what happened. So instead of going to Mexico to pay $800, $900, I paid $1,500, and I saved my tooth. And it was pretty bad sinus pressure because of that root canal. But traditionally speaking, since 2018, I have not had sinus pressure or a sinus infection. It was before when I lost all the weight, when I was obese, that I had chronic, I mean, almost every day. It was horrible, almost every day. And I was doing the neti pot every day. Now I do it probably twice a month. Unless there's something going on, like earlier in the year, earlier in the year, I must have had a sinus thing going on. I was doing it every day for about 6 weeks, but I usually don't do it every day. And last year during COVID, I was doing the neti pot too. I was like, okay, March, April, I took a PCR test. It was negative back in April, whatever it was. And I was like, you're going to irrigate your nose before you go in. I did that for about 2 weeks. And then I did it again in August. I did the test again in August. I kept on getting asked, have you taken a PCR test? And I'm like, how many do you want me to take every week? My God, this is ridiculous. So I did again, irrigated my nose for about a week before, negative again. And then I did it again on December 10th. And every time I went in, I irrigated my nose and I was negative again. But I also had the IgG tests and I was positive for the IgG antibodies. So that was August, and then in October, and then again in November. And after that, I was like, okay, I'm not paying $30 or $25 again. This is ridiculous. I said, I'm not going to go and keep on paying $25 or $30 every 6 weeks or every 8 weeks or every 3 months just to prove to somebody that I have IgG antibodies when they don't freaking care. These people didn't care that had IgG antibodies. They don't care. It's like, oh no, we don't care. We just want to know if you were positive for PCR. Okay. No, I took the test 3 times. No. And I think that's why I was irrigating my nose so much because of COVID. But I tell you, there's so many benefits to neti pot. There's so many benefits to irrigating the sinuses, and it might decrease the inflammation in those polyps. It might. I don't know. It could. So if it wasn't for COVID, maybe I wouldn't have been washing my hands so much last year and wiping down my counters so much. And if it wasn't for COVID, I might have not have been irrigating my nose as much as well. And I'm one that has to really be careful about my hands and my counters because of the skin infection that I had in 2019. That was really bad. It was just this little thing. Acne. I don't know what it was, but that little thing that I had, whatever it was, turned into a monstrous acorn-size infection. And then I went in and got clindamycin, and then I had an allergic reaction to that. It was like 12 hours later, and oh my God, I had to be admitted. I went to the hospital 3 times. I had to be admitted, and I was on like 6 different antibiotics and ruined my gut health for 6 months. Ruined my gut health. Ever since that was Memorial Day, that whole week, Memorial Day. I was in the hospital for a whole week, started on Memorial Day, and got out the day before June 1st. And it was May 31st I got out. And ever since then, my gut microbiome has been messed up. Ever since then. It has been like an uphill battle. And I need to get my microbiome back on track. And I can't do it by overeating. Just like an alcoholic, I cannot buy those certain brands of chips or certain brands of gluten-free whatever. I will eat the whole box within 5 hours. I can't stop. It's not like, okay, take 4, look on the bag, serving size, 11 chips. Yeah, right. Are you kidding me? You know how many servings are in a bag? 5. If 11 chips, that means it's 55 chips. I'll eat 55 chips in 55 minutes. Are you kidding me? I'm not exaggerating. If they're not, if corn, yeah, I'll buy corn chips once in a while. I'm not too big on corn chips, but gluten-free, non-corn, cassava flour, almond flour crackers. Oh my God, get that out of here. If they're served by someone else at a party, it's better for me because I know there's a limited supply. But if I'm buying them, oh my God, forget it. Forget it. It's like, how many bags can I buy? Just keep on buying them, just like the alcoholic. Now I understand. Now I get it. I cannot control myself. And I'm doing the intermittent fasting. I mean, I got my coffee here. I got to go back to tea. I got my coffee here with butter in it. It has salt in it. And I don't like a lot of salt because it contributes to puffiness. Too much sodium, puffy. I think it's the sodium too that's making me all puffy. It's not just the gluten. It's not just the dairy. It's not just overeating. It's not just one thing. You go to your doctor and you say, hey, doc, why am I doing this? It's not just one thing, right? Your doctor says, it's not just one thing. It's this and it's that and it's this and it could be this and it could be this. And you're like, just give me one answer, please. I just want that one thing gone, right? We all, give me the one thing gone. I just want that one thing. We all want it easy. It's not like that. I can tell you that if I had put coconut oil in this, I probably would not be happy with my coffee. I do not like the taste of coconut oil, even though it is an omega-3 fatty acid and it's not omega-6. There's a lot of health benefits to coconut oil. I don't like the taste. I don't like the taste. So we'll see how it happens with this nasal polyp thing. And it's funny because I am like, absolutely no to a nasal polyp surgery, but I am considering a total knee replacement. It's crazy because when I was 13, I started falling on my left leg to protect the right hip because I had screws in it, and then the screws came out when I was 14. But just because screws come out when you're 14 doesn't mean the trauma and the memory is gone. I remember falling. I remember going into surgery. I remember waking up. I remember the fear that I had when I dislocated my hip. That didn't go away. It's still there. I still have a memory. And just because I was 14 doesn't mean I wasn't a kid. I was still a child. And I wanted to play and I wanted to do those things that children do. And I just fell on my left leg. And now at 45, almost 46, I think I tore my meniscus last year. I really do. It's not good. I can still hear pops in my knee sometimes when I walk on it. And I'm like, oh, crud. So here I am thinking total knee replacement has to be the last option. I have to figure out. Think I want to take ibuprofen? No, I don't want ibuprofen. No, even though it might help with the pain, it's not going to help my gut. But I want the pain gone. And I can tell you, a total hip replacement, no pain. No pain. Now I had really bad arthritis. It was bone on bone. It was really bad arthritis. I don't think my arthritis is that bad in my knee. Can I can I wait 5 years or 4 years until I'm 50? I don't know. But I can tell you for sure, I do not want the sinus, anything going up in my nose. It's just not worth it for me to say I can't breathe and have a panic attack for 3 days. If they can do one side and I can breathe out of the other nose, and then a year later they could do the other side, but they come back. It's like, no, I don't want that. They come back. I've heard people having a surgery in 2004, and then they got to go back in 2008, and then they got to go back in 2012. They got to go back like every 4 or 5 years. And I was like, do you know how fast 4 or 5 years goes by? I've been living here for 3 years now. It went by like like that. It's been 3 years since my mom died, almost 3.5. It went bad like so quick. I don't want a surgery where something comes back. If they can guarantee me, or like 90, if they can have a 90% rate where they don't return, that might be a good reason for me to have the surgery for my polyps. And I wouldn't wish this on anyone. It's not a fun thing to where you just can't breathe or it's hard to breathe or anything. And I have a medical note that says I could wear a plastic shield. What if somebody didn't? What if somebody didn't have that? Oh my God. Geez. I feel bad for the nurses and doctors. I really do. I really do. Just, oh my gosh. So that's that. And what is this? June? So by Thanksgiving, you know what? I'm going to wait until after Thanksgiving because I don't know what I'm doing. I never know what I'm doing for Thanksgiving and Christmas because I don't have a family. I don't have brothers, sisters. I don't have mom. My dad's in Texas, but he has bed bugs. I'm not going to go over to his place with bed bugs. They hitchhike. I'm not going to do that. So I don't know where I'm going to go this year for Thanksgiving and Christmas. I really don't know. I might just enjoy it here by myself. I might do that because I know I'm not going to give myself anything that I don't want. You know, I know I'm not going to feed myself something that's going to trigger an inflammation response. You know, so yeah, I don't know. But if I go over to somebody's house, I'm pretty certain that I'm probably going to have food that's going to trigger an inflammation response. But if I eat very little of that food, very little, and I'm talking about that much, it might be okay to where I can decrease my inflammation response and then I can return back after Thanksgiving or after Christmas, and I can tell you how it's going with my sinuses. I would really, really like to share the outcome of this, but I have to keep it up. I have to keep it up. I have to really be on myself and lay down the law and say, no, you are not going to have these things. And science is evolving all the time. We may find out that down the road that, yeah, gluten and eggs and dairy and all these other things, they do contribute to inflammation in the nose. It does make it harder to breathe. You know, maybe there'll be a contraption for something that's like a breathe right strip to push this down to open all that up, as it feels amazing when I do that. That feels like, can I just do that? Can I just do this all day long? Can I have a personal assistant just to do this all day long? No. So take care, guys. This is not medical advice. This is just me. And it's just me saying what happened to me and in 2012 with the surgery that I had. And it was a long process to get that surgery. It was long, but it was well worth it. I needed that surgery. I needed that ovarian cyst to come out. And I'll report back to you later in the year, either around Christmas or the beginning of 2022. Whatever works for me, and whenever I see that there is a response to anything that may be working to where I'm feeling a little bit less clogged up. It's not good feeling. It's not a good feeling to feel like you can't breathe. All right, take care. Bye-bye.